Hi, Untamed TV fans. I'm your host, Craig Bielek. Thank you for joining us today. We're talking about something very important. Very, very important. I've got Dr. Derek Walker with me from Mountain Star Canyon Surgical Clinic. And as many of you may have heard, hopefully you've heard, the American Cancer Society has issued some new guidelines on when people should be getting colonoscopies for a number of reasons, and Dr. Walker and I are going to get into that in a second. Super. But Dr. Walker, maybe you could start by explaining what the new guideline is.
Perfect. Well, thanks for having me, Craig. So the new guideline is that we start screening at 45. It used to be 50, but 45 is the new recommendation because of the increased frequency at which they're finding colon cancers in younger patients. That might be getting screened for other reasons. Maybe they're having symptoms of blood in their bowel movements or change in bowel habits. And because it's an increase in frequency, this is the new recommended guideline.
So 45 instead of 50. It used to be that was the big rite of passage. You
Correct.
You hit 50 and you had the big party and all that. And then you marched over for your colonoscopy if you were smart.
Correct.
Because I think a lot of people go, well, a colonoscopy is just a test. It doesn't really show anything. And the fact is they do save lives.
Actually, it's probably the best method we have of identifying the precancerous polyps at an early stage and getting them out. Now, there are other tests people can do. Let's say they're just scared of having the colonoscopy because it's an invasive procedure. There are risks, albeit small. But what else is out there? Well, they have something called a FIT test where we're looking for occult blood, so blood that you can't see in your bowel movements. They also have a test called a Cologuard test, which is looking at DNA being shed by polyps. So these are all good kind of screening tests, but if they're positive, they still recommend you get the colonoscopy.
Right.
And then there are also at certain hospitals that have the appropriate imaging. You can do a CT colonography, which is basically a CT scan, very thinly sliced, that can reconstruct the colon. Still requires a bowel prep, and if they see polyps, they still recommend a colonoscopy. So that's why I still think
just get a colonoscopy.
It's probably the best.
Just get the colonoscopy.
It is.
And get it over and all of that kind of
Correct.
stuff. So this is a two-part question, but approximately how many colonoscopies do you do a year, and do you find cancer?
You bet. Good question. I would say on average, myself and Dr. Bryce at our clinic, we're general surgeons, but probably 40% of our practice is GI work, which includes these screening colonoscopies. So I can speak from a general surgery standpoint. Gastroenterologists do these a lot, more than we probably. But I'd say probably 250 to 300 a year, potentially. Is not uncommon. And out of every 100 colonoscopies, we'll probably find a colon cancer.
Right.
So that's on average.
Right. And the good news is colonoscopies can catch colon cancers early.
Correct. And that's the best news.
Right. I have a family member, you and I were talking right before this episode, that just had a bout with colon cancer, and the fortunate thing is we caught it early. And so it was a surgery and didn't require any sort of follow-up or radiation or any of those sorts of things. So that's good.
It's something to be aware of. It's about 6% lifetime risk of developing colon cancer in the general population.
Wow.
If you have a family histories, especially if someone was younger than 50 when they were diagnosed, it increases to 8-fold. So quite an increase. I'd say it's the second leading most common cause of death to cancer. And it's probably the third most common in men and the second most in women.
In addition to like your family history and all that, there's also some habits and things like that can put you at a significantly higher risk.
Correct.
Or at least a higher risk. And what are they?
Well, smoking, heavy alcohol use, in fact, red meats, diet high in consumption of red meats, processed meats. And which it's really the animal fat. Increase in animal fat causes increase in cholesterol within the colon, and from that you can get free radical formation, and so that is a potential risk factor.
Right.
So,
I think a lot of people, well, first off, they avoid the colonoscopy because, it's embarrassing and all that. And I've had a couple, and folks, it's not.
Right.
It really isn't. Depending on who you are, I'm sure there's some people that, but I think that what they need to understand is the test is very simple and not unpleasant or anything like that. Now, the prep is a little
right. I mean, we call the prep a necessary evil because we have to see. So one risk is missing something. So even with a very good colonoscopy prep, it's about 95% effective in seeing the entire lining, and that's because of the twists and turns and folds that we have. But again, the best method of seeing polyps, you can see as small as 3 millimeters and get them out and get them analyzed. We worry about bleeding, and folks are on high-dose blood thinners, these super aspirins that people are on for either heart stents or history of clots. And then the last risk, which of course, scares people the most happens absolutely the least. That's making a hole in the colon.
Right.
It's a hollow tube. We have to be careful. Now, from my standpoint, we're the only ones, the provider doing the procedure is the only one that touches the scope. And the polyps we remove, I'd say 99% of the time we see a polyp, we can get it out safely. If we can't, then we would sample it, mark that area, and wait for the biopsies to come back and decide what we need to do to go get that, maybe surgically speaking, but not try to pull it out at that time and cause a hole. But during this time, the patient's resting comfortably. They're under sedation, and as far as they're concerned, they're not feeling anything. So that's a nice way to have it done.
Right. And the other thing I think people need to understand is removing a polyp doesn't hurt.
Yeah, if you were awake and watching it, the lining of the colon's insensate. What the colon senses is stretch, and that's why if you're not under complete sedation, you can feel that. You'll feel that. The uncomfortableness of the stretching.
Right. Do you know why the American Cancer Society changed the recommendations? I know you mentioned that we were seeing more colon cancers in younger people, but do you know what the factors are that are affecting that? Like, why all of a sudden?
Well, I think I don't necessarily know if it's all of a sudden. I think what they do is they accumulate data each year, and they can see, is there an increase in frequency? For instance, with breast cancer, we got an increase in frequency because we had better screening modalities, and so we were catching the cancers at a smaller stage, which meant, the frequency of cancer went up, but the longevity or the cancer-free survival improved because we were catching it at an earlier stage. So I think because the increase in frequency of which of younger patients being caught or being diagnosed, with cancer, is probably the big impetus for the change.
Wow. So if you just joined us or you're wondering what your takeaway is from this episode, it's basically this. Colon cancer can save your life, or colonoscopy can save your life. Prevent a lot of colon cancers. And it used to be that you needed to be screened starting at 50, but the American Cancer Society now is recommending that you get started at 45.
Correct.
And maybe even younger if you have a direct family history. Is that correct?
Well, sure. And it's usually 10 years younger than that person at the age that they were diagnosed. So this becomes more of an issue in someone younger than 50, or if you have 2 first-degree relatives, or if you're having symptoms in general, which would include change in your bowel habits, blood in your bowel movements, or increase in abdominal pain. All these can be signs that something's going on. You need to be evaluated.
You need to be evaluated.
Correct.
And I think that's important too, because a lot of people might have those symptoms and oh no,
right.
I'm in deep doo-doo, so to speak. But other things can cause those too.
Sure. And you're going to get some blood work, and potentially there's some imaging studies before you would jump to a colonoscopy. But
that's great. So there's your takeaway. The other takeaway is Dr. Walker is a nice guy, and you should be making your appointment with him. We're going to flash a phone number on the screen right now for Brigham City Community Hospital and Canyon Surgical Clinic.
Correct.
Mountain Star. There's your phone number right there. Don't put it off any longer.
Yeah.
Do it. If you're over 45, do it. Your insurance will cover it. There's ways to pay for it if your insurance will not cover it.
Correct.
Those sorts of things. 435-723-0329. Call Dr. Walker and say, Dr. Walker, help me out.
Yeah, we'd be glad to see you. Thank you.
Be glad to see it, and you'll be glad you did it. Trust me on that. Craig Bielik with Untamed TV, your host with Derek Walker, a DO up at Brigham City Community Hospital and Canyon Surgical Clinic. Get your colonoscopy. Do it now. Yep. I mean, not today. You got to prep, but do it soon.
We'll see you soon.
Thank you.
All right.
Untamed TV. Untamed. Untamed.